I think that's what so much of healthcare transformation is about. It's about the cultural change as a country and as communities. What do we want to see in our healthcare system? What should it look like? What should equity look like? I think part of it is also giving providers the supports, the tools, the information that they need to help manage populations that are more complex.
We've had conversations with health plans who receive sort of this capitated payment from both Medicare and Medicaid, and they noticed in a couple of their elderly patients who seemed to be a bit depressed and were having some health outcomes kind of out of whack. And for them, they sat down and had a conversation with this group and figured out they couldn't get to church on Sunday. So this health plan actually operates a church van to go and pick up elderly women to take them to church, improve their depression scores, improve their health outcomes. And for them, it's a social issue, but it directly ties into health impacts and then healthcare costs for a payer. So, thinking about what other social issues that could be both positive or even negatively impacting kind of health outcomes.
The figuring it out is really about going upstream and making connections outside of the clinic walls, including public health agencies, because part of what a primary care provider is dealing with a certain segment of the population and they're seeing certain incidences. But if you can add that data up at a community level, public health is trained to see those patterns and to say, well, why are we seeing asthma in this particular neighborhood, in this particular building? What's going on there from an environmental perspective that we as public health can address?